Hi, welcome. My name is Dr. Sarah Rogers. I'm with Idaho Naturopathic Medicine, and today I am joined by Dr. Madison Peach-Keen, a pharmacist here in the Treasure Valley of Idaho with Medicat Pharmacy in Meridian. Dr. Peach-Keen, thank you for joining me today.
Hey, thanks for having me. Happy to be here.
Yeah, so I really wanted to talk to you because you're a compounding pharmacist, and I wanted to talk about compounding pharmacy as well as a specific compounded medication called low-dose naltrexone. But first, let's just talk about what compounding pharmacy is, how you became a compounding pharmacist, and why you like it.
Yeah, compounding pharmacy is wonderful. Obviously, I'm a little bit biased, but it's basically customized pharmacy. So it's all customized medication, tailored dosing, dosage forms that work best for the patient, which might not always involve swallowing a capsule. It could be applying creams topically, locally, directly to the site where they're needed. So you get very targeted drug delivery. It could be combining multiple medications together so that you can have, better adherence or compliance. Sometimes maybe helping with just your basic pill burden. And then customized dosing. So, if you have something on the market that is dosed for an adult, maybe that doesn't work, the same for a child or for a bird or, the whole spectrum of patients that we deal with. So compounding is there to meet all those needs, and we are working with typically working with that pure powder. So sometimes you can also create a cleaner product with less fillers and dyes, and you can avoid artificial sweeteners and such. So it's a very clean way to compound if you're looking at patients that have a lot of sensitivities, and then it's a great way to get that perfect dose for your patient. And so it's all about customizing exactly what the provider and the patient end up needing.
Right. And I really appreciate it as a naturopathic physician where we do individualized care. This is individualized, treatment, which is awesome. I also really appreciate like with topical hormone doses that when you get like a progesterone over the counter, you have to take like teaspoons of this stuff. Whereas you could actually create something that's like really concentrated and you only need like a little dab or something. So I love that.
Yeah, it's really, really nice if you're looking at, a patient having to apply, like you said, a large amount of cream. We can concentrate that down and make it a lot more manageable. And then, it's less surface area you're worried about, contamination. I mean, it's usually ends up being a win-win-win for,
Right.
patients and providers.
Or if somebody's having trouble swallowing, you can make it into a lozenge or something like that, right?
Yep, lollipops, lozenges, mouth rinses. I mean, there's a number of different dosage forms that can work in a variety of different areas. And so, that's where I come in as, a provider like yourself would call me and say, hey, I've got a patient. This is what we're dealing with. What can you do? And I'll give back a number of ideas, even different drugs that I've seen used in that scenario. Because compounding is basically your off-label use of commercial products. So it might be a drug that's available on the market as a capsule, and it's never been brought to market as a cream, but it does have some wonderful effects when applied to skin locally. So it's the experimental side of pharmacy, but there's definitely a need for it, and it's really really fun part of pharmacy to be with.
Right. Experimental but safe. Let me just emphasize this that
Yes.
you are a pharmacist, you have a license, you know what you're doing. I really like calling up the compounding pharmacist or any pharmacist in general when I have a question about drugs. And just, I feel like I'm going to sound stupid, but I've never had a pharmacist ever talk down to me. You guys are great in educating physicians about what we need to know about drugs. And I really love the compounding pharmacists we have in the Valley, including yourself, that can help us figure out what is best for each patient. So I love that.
Yeah, it's definitely a field that needs some extra education. And my background, when I got out of school, I actually started in academia. I used to teach compounding pharmacy in Houston and then around the country as well. So I would go to colleges of pharmacy and just try to raise awareness and spread that education, because even in the pharmacist community, there isn't a great deal of knowledge for compounding. Most people see it as kind of an old school, that's how pharmacy used to be, but it's very relevant, it's very current. And education and awareness is a big thing for the medical community and then also for patients, so that they know this is an option that they can ask for or investigate and see if there's anything we can do to help.
And you actually do consults sometimes directly with patients, right?
Yep, I'm available for consults. We have a team of pharmacists at Medicap Pharmacy that can sit down and go over, nutritional information. We can look at optimizing the treatments that they're on, and we work closely with their providers to just see what's best, most affordable, and kind of try to find that perfect sweet spot for all of their needs. Their financial side of things, and then obviously trying to better their outcomes for whatever we're trying to treat.
I love it. I love it. I love it. I love it. So, is there anything else you would like to tell people about compounding pharmacy before we move on to naltrexone?
The only thing I always like to bring up is it's not just for humans. So we treat the whole family. I do a good bit of veterinary compounding. That's one that kind of gets forgotten a little bit.
Mhm.
So it's having 4 fur babies myself that a couple of them need medication. Being able to compound that to get that dose or that flavor just right is a wonderful thing. If you've ever tried to give animals oral medications, it doesn't always go over great. So veterinary compounding is definitely a huge thing, and then we do a lot of pediatric compounding as well, in addition to the very common hormone compounding that you mentioned. So
Right, right.
there's lots of different ways we can help out, and if you have any questions, just call your local compounding pharmacist, and we'll see what we can do to help you.
Right. And not to tell the names of your competition, but one of the nice things about the Treasure Valley is we have a really nice group of compounding pharmacy companies. And
There we go.
so it is lovely to know that wherever they're almost like neighborhood pharmacies now, not quite as much as like the Walgreens or Rite Aid, but it's spread out throughout the whole Treasure Valley, which is really nice. And you are um, also in the East Valley or the West Valley, sorry.
So Medicap, yes, we have a number of different locations in some of the more rural areas like Parma, Nissa, and I believe we're opening one in Caldwell shortly. So we have a couple different locations. Oh, and Garden Valley. But all the compounding is done in our Meridian location. That's where my lab is. And then we send out to the rural locations to help meet those needs too. And you mentioned the network here. The Valley does have some really other some great other pharmacies, and we work together. I mean, it's a small niche field. Everybody knows each other, and if we have something that they don't have, or vice versa, it's about meeting patient needs. It's not a super competitive field, which is very nice.
Patient-centered care, right? It sounds
Yes.
very similar to naturopathic medicine, which is why we love you. Okay, so let's talk about Lodell's naltrexone. Some people might not have heard about that, but naltrexone's used primarily, like most people might have heard about it in treating people with drug overdoses. But the low dose naltrexone is a different story. And I got educated about that a few years ago to help some people with inflammatory pain issues. And I was wondering if you could also talk about because you've probably used it a lot more than I have. Can you talk a little bit about low dose naltrexone?
Yeah, that's one of my favorite topics. We do a good bit of that, and I'm very happy that it's becoming a little bit more mainstream. It has definitely increased in education and popularity in recent years, but we always need more education. So the usual question I get is, oh, well, that's for opioid reversals, and yes, it is. The commercial product on the market is about 50 milligrams. And so you're looking at that high dose, you get a complete opioid blockade. And so you get that reversal of the overdose. And so that has its purpose there. When you take a look at a lower dose, and we're talking, zero point 0.5 to 4 milligrams, like much lower than that commercial tablet, you get some different effects that happen. So you can still get an opioid block. So you have to kind of watch if you have patients on opioids. But what the lower dose will do actually, and there's a number of studies that support this, and even more ongoing studies now, which is nice. What you get with that lower dose is basically a reset of your inflammatory system. So we call it an immunoregulator versus an immunosuppressant or an opioid suppressant. So you get a nice reset at the top of your inflammatory process, and you get this nice, basically an optimization. So if you have out of control inflammation, this is going to give you like a nice short-term pattern interrupt, at the top of this cascade and give your body a chance to get healthy inflammation back in play. Whether, if you're in a chronic situation, then what you don't need at that point is additional inflammation. So you're stopping that inflammatory process, letting your body reset and realize if it actually still needs to be inflamed or if it doesn't. So of course, if you have an acute injury, you want a little bit of inflammation in the
Right.
area. So we're not talking about, changing the pattern at that point, but when you've got chronic underlying inflammation, which most people do with all of your comorbidities, like hypertension and diabetes and a whole list of different issues, you've got inflammation that is just out of control. And so naltrexone comes in at this lower dose to help reset that process and optimize it as an adjunct to your current care. So this isn't necessarily replacing what you're already working, but it's going to help optimize that whole inflammatory system. Just as one receptor it works on, it can work on some others. And so you can also get some relief for pain. It's involved with those opioid receptors at the lower dose.
Mm.
And you can get a couple of other receptors involved. So it does a lot of things, but for the sake of I think what you're getting at, you can definitely have some wonderful effects with it on the inflammatory process.
Right. And what I'm hearing is this: if you're doing a reset, this is also the great time to work with, your diet and taking out that sugar or the stress in your life and finding stress modification, whether it is from finding time to go outside and walk when it's not smoky. And find that joy back in your life so that you can help further reset and reduce that inflammatory response whenever you are exposed to something you can't control. So the low dose naltrexone is sort of like a regulator for that inflammation as well, is what you're saying. But also the
Yep.
other things that you need to do that naturopaths always talk about, or other functional medicine people talk about, it's like looking at your diet, looking at your lifestyle, looking at maybe some supplements like turmeric or curcumin, and fish oils that can really also help reduce that inflammation.
Oh yeah, by no means is naltrexone a magic bullet that you can just take and then you're better and you're
Mhm.
pain free. This, like other, treatment options or modalities or vitamins, it's part of the whole puzzle, right? And so this is a really nice piece you can add in for some patients that either don't want to jump to the big guns, like your agents that are going to suppress inflammation altogether or suppress your immune system just to get things under control. But it's not going to fix things by itself, and you have to titrate slowly. There's also a process that is involved, with naltrexone, where you can, if you titrate too fast, you can blow right past your optimum dose. It can have some minor side effects, but enough of a side effect that might turn patients off of it. Typically, if you get too aggressive on the dosing or you titrate too quickly, you can have patients that experience, some perhaps additional anxiety. The main one I hear about, if you get too high, can be some sleep disturbances and vivid dreams. But if you're looking at a patient that's, already in pain or already dealing with an ongoing chronic issue, you don't want to add anything to it. So it is really important to take your time titrating, to do it slowly and not jump your patient all the way to the top end of the spectrum, because they actually might be more happy overall physiologically at a medium dose or a lower dose, maybe just 2 milligrams, 3 milligrams. They might not make it all the way to 4.5.
Right, right. That is really good advice. And I think it's something that a lot of people don't know that that's an option for them to ask their physician about, or to ask their pharmacist about. It is a script. You can't just get it on your own. You have to ask a physician, and you should ask a physician who's trained in this. And what we can do at the end of this video is we will put the link to Medicat Pharmacy and Dr. Peach-Keen. And also I will be listing some of those research articles that she talked about, so you can read up if you're so inclined about low dose naltrexone. So Dr. Peach-Keen, thank you so much for your time today. Was there anything else you'd like to add?
No, just definitely happy to be a resource if anyone has questions. There's a lot of great information online about naltrexone too. There's some, I believe it's ldnresearch.org
Right.
or researchtrust.org, one of the main websites that goes over all the conditions it can help with. And it's a whole host, because inflammation is almost part of every chronic disease we're looking at today. We're realizing that that's really the base cause of it. And, this can be one part of that puzzle that can help you get it under control, in addition to, dietary, lifestyle, potentially some other pharmaceutical agents, depending on what we're looking at. So we like to look at the whole picture too. I'm definitely in the camp of functional medicine is the way to look at it, because you're looking at the whole individual, not just trying to give them a band-aid.
Exactly. We like band-aids for when you get a cut, but we don't like band-aids
Yes.
when you have an incredibly complex inflammatory condition. So band-aids
Yes.
are fun. I love band-aids. They're fun. So,
Yeah, but naltrexone has a wonderful place in therapy. We've got a lot of really happy patients on it, and we're just here to share that education. So thanks for giving us the chance.
yeah, no problem. It was delightful having you with us today. So as I said, I'll be posting Dr. Peach-Keen's information and Medicap Pharmacy at the end of this video, and also that research, LDN research site. So thank you again, and I hope you have a wonderful day.
Thank you so much. You too.